my gynecologist just prescribed that I use my vibrator 3 times a week. I know that sounds like clickbait, but it actually is true. And it's in connection with the fact that I suffer from menopausal dryness and atrophy in my vagina. And if you are suffering from that, I'm going to tell you, because I went for a consultation for that, 3 things that she recommended. And it was really, really interesting. So at Ray Skin, they've opened up a new gynecology service for hormone replacements, sexual wellness. The gynecologist that is there is one of the few in the province of Quebec that is licensed. She has a fellow in menopause treatment, in sexual wellness treatment. So if you're looking for hormone replacement and consultation on sexual wellness, Rhea Skin is where it's at. So let's get to my consultation. So I'm currently on Vagifem and I'm taking it twice a week. So she recommended that I up it to 3 times a week. And then there's a new drug on the market called Invexi, which is like a little sort of egg suppository that, again, twice a week or 3 times a week, that has a slightly higher dose. So that was number 1 recommendation. Number 2, if you are having sleeping issues because you're in menopause, she recommended progesterone. Yes, you've heard it here. So I'm going to try progesterone once a day for the next 3 months. And then try it for 12 months and see what happens if it improves my sleep through the night practice. And then she gave me a physical exam, checked my surrounding tissues in terms of my muscles. If your muscles are contracting and it's painful to have sex, you can actually go for physio down there. And there is a center here in Quebec, Centre Santé Pelvic at Kinetex in Pointe Claire. So you can have somebody work with you to relax those muscles to make penetration easier. Who knew about this? And yes, a vibrator 2 to 3 times a week at your clitoris to help stimulate blood flow, which also will help with the surrounding tissues of the vulva. At the end, we chatted about hormone replacement. She does recommend testosterone for women with low sex drive. And, it's about basically, playing it by ear, adjusting the dosage to make sure that you don't have too much, that you have male traits, and never use it anywhere near your face or your chest. You always want to use it on your legs in case you start to grow hair there. We talked about who's a good candidate for HRT, and she says all women are good candidates for HRT. And the earlier you start, the better the benefits you're going to get from it. We talked about bioidentical, like there's 2 types of hormones that she recommends. Either, like you take it ingested as a tablet, or you have the patch. And it depends on the sensitivity of the woman. Some women react better with the patch versus ingesting estrogen. But progesterone, the only one that is prescribed here in the province of Quebec is oral progesterone. We talked about, some of the naturopaths that are, providing pellets, but she says it's not regulated and the dosage may be too high, especially on the testosterone. So she doesn't recommend the pellets if you are taking them or if you know what they are, because they cut a little bit of your ass and they stick a pellet in for 6 months. And then those hormones course through your body. Can you take vaginal estrogen if you are on the patch? Yes, you can. Testosterone is probably going to be the next conversation I have. And how long can you stay on HRT? If you're feeling good, you can stay on it for the rest of your life. Thank me later.